Another drug for high blood pressure is calcium channel blockers, and we looked at calcium channel blockers before, where we said that calcium channel blockers, they vasodilate, or they open up the artery so that the blood can flow. All medications, including CCBs, including calcium channel blockers, have side effects. One of the main things that we looked at is that when we look at a calcium channel blocker, we should think of pine. Okay, so anything that ends in pine is usually a calcium channel blocker. And remember, when we're thinking of pine, we think of pine trees. Where do we find pine trees? Well, we find pine trees in California. So calcium and California, they kind of start, with the same CAL, the same letters. And so when we think of calcium channel blockers, if we combine CC, we get an O, right? Because you take this C, you flip it like that, and you take this, right? So you get a big O. And when we think of O, we think of this O or this circle over here, which means gingival overgrowth, we see puppy gums. Okay, so calcium channel blockers cause gingival enlargement. You can see how bad that is, right? And actually in an Imperial course, you're going to learn how you can manage people who have such puppy gums like this. Nifedipine is also called phenytoin. It's spelled like this, Phenytoin. So that's another way of saying, it's another word for calcium channel blockers, another word for nifedipine. Okay, let's look at beta-adrenergic blocking agents. So we talked about this before, where we said that anything that ends in olol is a beta-adrenergic blocker, right? And we said that if it ends in olol and you combine the OL together, you're going to get a D, right? You combine this, you're going to get D. And if you flip it, you're going to get BB, and BB stands for beta blockers. Okay, so anything that ends in OL is a beta blocker. And what beta blockers does is it blocks the receptor. It blocks beta 1 receptor or beta 2 receptor, and we looked at that before. Now, when we look at beta 1 blocker, beta 1 refers to the heart. Beta 2 refers to the lungs. So how can you remember that? Well, beta 1, we only have one heart. So one heart, that's why beta 1 is a receptor for the heart. Beta 2, we have two lungs, 1, 2. So when we say beta 2, that is for the lungs. So what the beta blocker does is if it blocks the beta 1, it helps with heart contraction, so the heart can contract a lot more better. And beta 2, what it does is it helps with the lungs. So it'll open up or dilate the muscles, and it'll also open up the lungs. Okay, so beta 1 and beta 2 receptors, these receptors are blocked by beta-adrenergic blocking agents, and beta blockers all end in olol. And as we know, anytime someone is in a heart condition, is taking a drug that is used for heart conditions, such as beta-adrenergic blocking agents, we will limit epinephrine dose. So it doesn't mean that we're going to get rid of the epinephrine completely from the local anesthetic. We're going to limit it. So when we give them freezing, we will give them epinephrine, but it will be limited, typically to 0.04 milligram. And remember, alol, right, or olol, those are different ways of, those are your tricks of knowing whether it's a beta blocking drug or not. So if someone are taking any of these medications, like we looked at antihypertensive agents, so we looked at diuretics, we looked at calcium channel blockers, we looked at beta blockers, we looked at ACE, we looked at ARBs, many side effects could happen. So we should keep an eye. We should keep an eye out to see if they have dry mouth. We should keep an eye out to see if they've got gingival enlargement. Remember, nifedipine can cause that. Orthostatic hypotension, this basically means that their blood pressure could go really low. So if we're lifting them up, let them sit for a minute or two before they get up. Otherwise, they'll faint on you. So many side effects that could happen when they are taking these medications. Okay. Anticoagulants, that basically means that when someone is taking this medication, it's a blood thinner. So typically what happens is our blood normally pumps nicely or normally goes through the vessels nicely, but sometimes we could get a clot. And when that happens, or the blood could just clot in one area, and when that happens, the blood won't flow nicely. And so to avoid that, what doctors will do is we'll prescribe a blood thinner so that the blood gets very thin and it can easily pass through. One main example of a blood thinner is warfarin, also known as COUMADIN. And this is after a heart attack. So how do we know that warfarin is an anticoagulant? How do we know that warfarin is a blood thinner? Well, one way is you think of warfarin, you think of war, because it starts with war. And in war, there's lots of people that are bleeding, right? So think of bleeding, so lots of bleeding during war. So warfarin causes a lot of bleeding because it's a blood thinner. Anytime the blood thins out, if we get cut, we will be bleeding for a very long period of time. So if we are debriding in someone's mouth and they have warfarin, we need to take precaution. We may not want to treat them when they're in warfarin, because if we're debriding and we're scaling and there's lots of blood, the blood won't stop. The blood will keep, coming out. So someone who's in warfarin, it's a red flag. We may not treat them, and I'll talk about that more later on. So the trade name for warfarin is COUMADIN, and COUMADIN, think of coma, maybe. And so when you're in the war, people could get into coma because they were bleeding like crazy. So warfarin, COUMADIN, think of bleeding, lots of bleeding, because it's a blood thinner, so you will bleed a lot more easily. Now, as I was saying, anytime someone is taking this drug like warfarin, we need to check their INR. And INR is called the Internationalized Normalized Ratio. It's basically a blood test that they take, and they usually take it every month. So if anyone who's on warfarin, they go regularly to the doctor and take this blood test. And the blood test tells you a number. And if the number is 3 and under, then you're okay. You can go ahead and do dental procedures. You can go ahead and scale. But if their number is higher than 3, so if it's a 4, 3.5, or 4, or 5, then we cannot treat them, because that means they will be bleeding like crazy when we treat them, or when we clean their teeth. Okay, so we do not want them to bleed out or hemorrhage during dental procedures, so we need to make sure that their INR number is less than 3. And how do we know? Well, we ask them. We know they're taking warfarin, we need to ask them what their INR number is. And most of the time they know this, because they can even test themselves home. There are kits that they can take at home, and it just looks like a diabetic kit, right? But it's actually used to check their INR numbers. So this is 2.7. 2.7 is safe. We can treat them. So any number under 3, we can treat them. Aspirin, if you take with warfarin, aspirin is also a blood thinner. So there are significant drug interactions that could happen. People who get a fatal bleeding episode or fatal hemorrhage that can occur when they combine aspirin with warfarin. Something to think about. Another type of blood thinner is heparin, also an anticoagulant. So think of heparin that rhymes with warfarin, right? So they're both blood thinners. And then here's another one, PLAVIX, or CLOPIDOGREL. And this is another type of blood thinner. It's another anticoagulant. And what it does is if we have lots of plaque in our blood vessel, it's hard for the blood to flow. So what they do is the doctors will prescribe a blood thinner so that the blood gets thin and it can easily flow through the blood vessels. So how can we think of, or what's a memory trick for this? Someone said that if you think of this medication, the CLP kind of looks like clumpy. PLAVIX, which is the brand name, kind of looks like plaque. So reduces clumpy plaque, you could think of. Reduces plaque in the blood vessel and helps the blood pass through. It's a blood thinner. And it's especially used when we have plaque in the blood vessel. So let's recap everything that we've learned. There are many medications that we use for heart, and doctors to prescribe them not in just one. Like if they don't prescribe just one medication, they'll prescribe many because they want to attack the heart in many different angles. And so to attack the heart in many different angles, they may prescribe one beta blocker. They may prescribe one calcium channel blocker. They might prescribe a diuretic, an ACE inhibitor. So let's look at some. Diuretics, we said, ends in "ide." And how do you know that anything that ends in "ide" is a diuretic or a water pill? Well, look at IDE. Look at this ID. Flip it around, you get DI for diuretic. Okay, so ide is the diuretic ending. Beta blockers, they end in OLOL. So remember, when we think of OLOL, we should automatically think of BB, beta blockers, because OLOL, if you combine it, it's D and D, right? So if you combine these OL and OL, you get D and D. If you flip it, you get B and B. B and B stands for beta blockers. Another way to treat the heart is calcium channel blockers. And so the common one we know of is nifedipine. And so nifedipine treats gingival hyperplasia. So remember, we said pine trees are found in California. So California for calcium channel blockers. Anything that ends in pine is a calcium channel blocker. Gingival hyperplasia is very common with calcium channel blockers. So C and C, if you take C and C for calcium channel blockers and you combine it, you can get an O. So here's the first C, here's the other C that's mirrored. And so when you think of a big O, think of gingival overgrowth, okay, or gingival hyperplasia when we got puffy gums. We looked at ACE inhibitors. And actually, one thing that I didn't mention is that it actually causes a dry cough. My dad, when he had his heart attack, he got prescribed this medication and he always had a dry cough for like years and years. And that's because this medication, one of the side effects is a dry cough. So when someone takes ACE inhibitors, we know that it ends in pril. So remember, it's like a chill pril. It relaxes, it chills the heart. Think of April. In April, we may be indoors. We may want to play with the ace cards. So pril, ace, right? April for ace. There was a trick we talked about earlier. You can review that. So when you see pril, think of ACE inhibitors. Last one we looked at, or another one we looked at, is ARB, which is called angiotensin II receptor blockers. What it does is it basically opens up the blood vessels and they end in TAN. Okay, so when you think of TAN, think of ARB. So we're talking about Airbnb. When we go to an Airbnb, we like to tan ourselves, right? If we go to the beach to tan ourselves. So anything that tan is for Airbnb or ARB.